How common is pulmonary embolism with sleep apnea? Have you ever wondered about the connection between sleep apnea and pulmonary embolism? It's a topic that deserves attention, especially since untreated sleep apnea can lead to serious health issues. Let's break down the facts. Pulmonary embolism, which is a blockage in the lungs' arteries, occurs more often in individuals with obstructive sleep apnea. Research shows that around 60 to 65% of patients diagnosed with acute pulmonary embolism also have obstructive sleep apnea. This indicates that sleep apnea is not just a sleep disorder. It may also be a significant risk factor for developing pulmonary embolism. The severity of sleep apnea plays a role in this risk. The apnea-hypopnea index measures how many times a person stops breathing or has shallow breathing during sleep. As this index increases, so does the risk of pulmonary embolism. One study found that for every 10-unit increase in the apnea-hypopnea index, the risk of pulmonary embolism rises by about 45%. Patients with untreated obstructive sleep apnea are also more likely to experience recurrent venous thromboembolism, which includes pulmonary embolism, after an initial event. This means that if someone has had a pulmonary embolism before, untreated sleep apnea can increase the chances of it happening again. The link between obstructive sleep apnea and pulmonary embolism involves several physiological changes. Sleep apnea can cause intermittent low oxygen levels and repeated awakenings during the night. These factors can lead to inflammation and an increased tendency for blood clotting, which can result in blood clots traveling to the lungs and causing pulmonary embolism. When it comes to clinical outcomes, patients who have both pulmonary embolism and obstructive sleep apnea may face more severe health challenges. Some studies suggest that these patients may have a higher in-hospital mortality rate, while others do not find a significant difference in short-term mortality. However, the presence of sleep apnea in patients with pulmonary embolism is associated with a higher risk of recurrence and potentially worse cardiovascular complications. Recognizing and treating obstructive sleep apnea is essential not only for improving sleep quality but also for reducing the risk of serious complications like pulmonary embolism. Early diagnosis and management, such as using continuous positive airway pressure therapy, can help lower the risk of blood clots and improve overall cardiovascular health. In summary, pulmonary embolism is relatively common among those with obstructive sleep apnea. The presence of sleep apnea can increase both the risk of developing pulmonary embolism and the likelihood of its recurrence. This highlights the importance of screening for sleep apnea in patients who are at risk for or have been diagnosed with pulmonary embolism. Addressing sleep apnea can be a key part of comprehensive care.